Hi everyone, welcome to this EDIC 2021 workshop. My name is Jess Griffiths. I am the clinical lead for BEAT, and I'll be taking you through this workshop today, which is about eating disorders training in medical students and foundation stage doctors. So here's the workshop outline. I'm going to introduce you to the project and I guess give you a good overview of why medical training is so needed in the realm of eating disorders. I'm going to talk you through the e-learning modules that we've created and also talk to Dr. Kiran Chitale, who's going to explain a little bit about the scenario-based training that we've created together as a team. And then I'm going to show you some excerpts from the pilot training sessions that we delivered in November to medical students and foundation trainees. We use these sessions to gain feedback on how to improve the training, and we just thought it would give you a flavour of what the training might actually look like in practice. So as you might have known, in 2012, Avril Hart, a 19-year-old student, died as a result of anorexia nervosa. 5 different NHS services had missed multiple opportunities to save her life over 5 months. And in its 2017 investigation, the Parliamentary Health Service Ombudsman found that Avril's deterioration and death were avoidable and that she'd been failed by each of the NHS organisations involved in her care and treatment. Aspiring to ensure that no other family has to endure what Avril and her family experience, the PSHO noted that the majority of medical professionals had received little or no training on eating disorders during their education and recommended that this be addressed. And as you're aware, Dr. Agnes Ayton conducted a survey of medical schools, and the results showed that actually on average, doctors get 1.8 hours of training in their career. So leading on from the PSHO, I guess it was re-emphasised when the House of Commons Public Administration and Constitutional Affairs Committee reviewed the progress on the recommendations in 2019, calling for eating disorders to be covered effectively in both the undergraduate and postgraduate medical curricula. So this teaching package is therefore provided to enable medical education establishments to ensure that all medical students and foundation trainees are trained to understand, identify and respond appropriately when faced with a patient with a possible eating disorder. It is the result of a collaboration between BEAT, Health Education England and the Royal College of Psychiatrists Faculty of Eating Disorders. So let's introduce you to the team that have created these materials. So we've got Dr. Kiran Chitale, who will meet a little bit later on in this workshop. And as I said, she's part of the Faculty of Eating Disorders. She's also a child and adolescent psychiatrist and has such a wealth of experience in regards to training in eating disorders. And she'll talk us through some of the practical ways she's incorporated that into her role later on in this workshop. We've had Dr. Ellen McPherson, who's a foundation stage doctor with lived experience herself, and it's been so insightful to be working alongside Ellen, who's actually practically working as a doctor now in hospital, and also hearing how she wanted to make things better in terms of eating disorders training, even in her own placements and in her own medical college. So we'll hear from her a little bit in the pilot of the simulation training that we'll see later. And we've got me as the clinical lead for BEAT. You might also know that I actually co-chair the Parliamentary Health Service Ombudsman's Delivery Group. So I guess I support the team to be able to deliver on the recommendations made by the PHSO. We have Andrew Radford, who's the CEO of BEAT, and we've also had Rachel Poyner, who works for BEAT as the senior project manager, who's been keeping us all in line and up to date and on time with deadlines. As part of this project, we really felt it was important to get the GMC involved, and we wanted to do this, I guess, to make sure that what we were writing would fit into a curriculum. And so they have had some oversight on the modules we've created and give us feedback on how to make the training as relevant for medical students and foundation trainees as possible, but also accessible to the medical colleges. And then Health Education England is the organisation that has actually commissioned this project. And we've been meeting with them as a project team pretty much every month to review progress. We've shared the materials with them, and they've signposted us to other people that could support the project, and have been really helpful in regards to making this a really meaningful training package. So I'm going to talk you through these two different packages. So the first one is ideally for fourth year medical students, and it's a 30-minute e-learning module packed with lots of really good information. Some of the aspects of the module we're able to glean from some of the courses we've written here at BEAT before. One of those is called Beyond the Symptoms. So actually the learning outcomes involve identifying the major eating disorders and spotting the early warning signs, which we know is so key to that early intervention with eating disorders and that community response from health professionals in general. We really felt it was important to understand the role of starvation in eating disorders and the effects on the brain, and understanding common challenges experienced by clinicians identifying people with eating disorders. And I think to make this as interactive as possible, we've created lots of tools. When I say we, the e-learning for healthcare, who have been developing the online package, have ensured that actually students need to complete all of the module to progress and get the certificate. They give a kind of a time space bar at the top, and have added lots of features to ensure that actually all the medical students have to complete the session to move on to the next stage, which is the scenario-based training. We really wanted to give lots of practical resources to doctors as well. So there's a resources section in the e-learning module. And as part of that, it's expected really that there's 3.5 hours of self-directed study as a result of the module. Combined then with the scenario based training, which I'll show you in a minute, that's 7 hours training for medical students. And we feel that that's a good start in regards to giving them the foundations that they need to understand eating disorders better. So here we've got a little flavour of some of the design. The e-learning modules are still in progress, but are hoping to be released in spring of 2021, so hopefully early March. And I guess as we've been working along with the design team, even creating images, you might notice that I've got some kind of little images along the way, even in this PowerPoint. Those are actually designed by a person with lived experience. We really wanted the graphics and the images to represent eating disorders, you know, whether that's gender, ethnicity, age, and it makes such a difference to the feel of the training to get that feel, you know, absolutely right. So this gives you a little snapshot of the homepage we're working on, but we're looking forward to seeing it in its full form. So the scenario-based training. Now, Dr. Kieran later will talk a little bit about why we've taken this approach. So the scenario-based training is 3 hours of online training, and the idea is that at the beginning of the session, the person facilitating the session will kind of make a link between the e-learning modules and this scenario-based training session, so that actually the students know what's expected of them, what they, you know, in terms of taking that relevant history, which is one of the learning outcomes here. They've got all the tools they need to be able to interact with an actor or actress who's obviously role-playing a patient, and to make the situation feel as real as possible and real life as it can do. So our first scenario for the medical students is Maria. She's a 17-year-old girl who's been brought by ambulance service to the emergency department of the local hospital for medical attention. And as medical students, they're assessing the patient with the following tasks in mind: to take the relevant history to make a differential diagnosis, explain the initial investigations required to guide the future management plan, and there's no need to take a physical examination. And I think one of the things we really wanted to highlight in this training was communication. We know that quite often people with eating disorders struggle to say they're in crisis or say what's going on. So communication and having empathy is key to the learning objectives from this session. But also, as Dr. Kieran will explain a little bit later, actually giving the time to practice that communication with a really skilled actress can really support the confidence, I think, the confidence of the medical students in knowing how to address this issue. And you'll see a little excerpt later of the training session. So that's the training package for medical students. And now we've got the training for foundation stage. So once again, this is a 30-minute e-learning module, and we would have expected them to complete the first medical student module as well before undertaking this one. So what do we hope that they will learn from this e-learning module? So identify the occurrence of eating disorders in patients who may present with other conditions, understand how to assess for an eating disorder, understand from sufferers of eating disorders how they confronted their illness. So one of the things we really wanted to get across was some lived experience in regards to patient interactions with doctors. So some of our ambassadors have contributed videos outlining their experiences with doctors, and we're not trying to create shame here. I guess we're trying to indicate just how important that initial interaction with a doctor is, and how much power a doctor can have in the words they say. And I think from working alongside Kieran and Ellen, really I've begun to really have insight into just how much these doctors need to know when they come and they assess these patients. So we've really tried hard in regards to the resources on the website and the e-learning module to give those practical assessment tools, so that actually they've got a good checklist of things to work through, and then they can also concentrate on their communication and interaction with the patient. So the other aspect of the e-learning module is recognising the official guidance and care pathways available. And as I said, we've got plenty of resources there, including Marzipan, management of really sick patients with anorexia nervosa. We've got that physical assessment checklist. We've also got referral forms, physical ob forms, lots of tools really that have been collated from people who've said that these tools are really helpful in terms of supporting doctors with assessment of people with eating disorders. So leading on from that e-learning module, which has all the wonderful skills and tools that e-learning for healthcare have implemented, they then come to, I just wanted to show again another little slide. So this is a little kind of template of what we're working up for the foundation stage trainees online learning. When they come to the sim training session, which obviously I'm very enthusiastic about, once again, we wanted the facilitator of those sessions to bridge the gap between the e-learning module and coming to the scenario-based session. I think it's really important, as we've created these materials, we literally want to have them as a package that is self-explanatory. So if a medical college wants to use them, we can hand them over, and there's no stone left unturned, if that makes sense. So when it comes to facilitation, when it comes to the actors scripts for these scenario-based sessions, everything's included with the package so that someone can pick it up and deliver it. So scenario 2 is based on Alfred Moon, who's a 20-year-old man who collapsed at his university where he's studying sports science, brought out in by ambulance to the A&E department. And it's our hope that foundation stage doctors will build a report and try to engage the patient during this session, elicit a comprehensive eating disorder history, picking up clues appropriately, and explore his current concerns with an understanding of the biopsychosocial factors influencing, predisposing, precipitating factors, and contextual psychosocial factors perpetuating the illness. Understand his protective resilience factors, including his support systems and also his personality and temperament. Explain the need for further blood tests and ECG, and demonstrate skills with supporting his carers and family. We very much included carers and family information within the e-learning module. And you'll see from, I think from the experts I'll show you, it was really interesting. And when we piloted this session, we actually had another BEAT clinical associate trainer observing the session for us to give us feedback on how it went. And actually, I felt it was really important that she role played a carer or family member. So she actually stepped in a bit off the hoof and attempted this. And actually, it was a really interesting learning point then for the foundation trainees to be able to interact with a family member, but also to think about confidentiality and holding that intention with risk. So feedback from some of the students that attended the pilot sessions of the scenario training sessions were the training was really useful, really increased my confidence surrounding and talking to people who may present with an eating disorder. And this person actually said they saw a patient recently after the training and they were able to use the skills learned from the session and found them really valuable, which was such good feedback for us. Someone else said, I thought it was incredibly valuable and a really important training program to roll out. I would be very happy to promote this to my uni. Thank you. I think that this is such an important and often overlooked topic that needs to be better incorporated into our education. The ability to practice with the simulated patient and working as a group was so helpful, as it was so nice to get feedback and meet other medical students from different schools. The scenario made me question what I would do in that situation as an F1, which is in quite near future. This is really helpful for me to see where the gaps in my knowledge are. So this is the first part of the workshop. We're now going to talk to Dr. Kiran Chitali, who's going to talk a little bit more about how we develop these resources and why she chose the patient scenarios that she did.